Not every patient fits your clinic, but the ones who do value solutions and take action.
If you had that kind of patient that wants your help and they just want to get better, and you know that this is going to help them, that is what we call your ideal patient.
Want more like them? Watch now before they go elsewhere.
So the question is how do you find these patients? Who is your ideal client? So these are examples of my ideal client. I've had patients who have maybe tried cortisone and PT and aren't ready for surgery. They've tried some things, but they're not ready for the big kahuna. How many patients have you sent away? Hey, you don't need surgery, and so why don't you come back when it's worse? You're sending them away with no solution? And you have a solution right here. So consider this patient. Consider their age, consider their lifestyle, income, their healthcare needs. They need something between this cortisone and PT, and they're not better, but they're not really a good candidate for surgery. Think about those patients that are sitting in your office, those patients with the partial thickness rotator cuff tears, lateral epicondylitis, it's not better with physical therapy, greater trochanteric, hip pain, tendonitis, all of these patients that have tried these braces and injections and PT, and they're like, doc, this isn't good enough. What's next? And you're like, well, you're not really a candidate for surgery. Good news is you don't need surgery, but why don't you come back when it's worse? Why don't you stop doing the things that are making it hurt? Like, really? We have a solution. Also, think about their psychographics, which means what they value. They don't value stopping those activities. They want to get on with their life. They want to do the things that they love. They want to do things that they are passionate about. And then you consider their pain points, their decision-making behaviors. And by the way, you get a say in who you treat. So think about the patients that you like to treat, you love to treat. Think about those patients that if you had that kind of patient that's motivated, that wants your help, that's willing to do the hard work, and they just want to get better, and they're like, I don't care what it costs, I want to be better. I can't go on like this. And they're nice, and you like them, and you know that this is going to help them. Think about that patient. And then think if you had 100 patients just like that. That is what we call your ideal patient. Some marketing people call it an avatar, but I just think of it as your ideal patient and you want 100 more like them. Imagine if that, and I know you're getting this picture in your mind's eye of your favorite patient. You're like, man, I love treating this guy or gal. I love this. This is so fun. This is awesome. They do what I say. They just keep coming to me asking for solutions, and they're up for it. So that's your perfect patient. And really kind of dig in. You got to have a name, age, income. Just write it all down, and really, let me know, what they value. I know for me, one of my perfect patients is a PGA golfer who was going round and round and round and round and round with knee pain. He couldn't golf. He had a big tournament coming up, and he'd been going to doctors, getting injections, cortisone, hyaluronic acid, unloaded bracing, PT for 7 months. And now he has a tournament in 6 weeks, and he's panicked because he can't play. He can't walk the course, and they can't use carts. And so he's like, I got this thing, I've been invited, and I can't do it. So now this is where the rubber meets the road, and he's motivated, he has really big pain points, and he's ready to do whatever it's going to take to get him to this tournament where he can play golf, which is his passion. So now we're ready. This is my perfect patient for what his problem was, and I would love to have 100 more just like him. So that's who we're going to be speaking to. That's who we're going to be talking with and talking to over this next little bit.
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.